Hello, and welcome to McDougall's Medicine with Dr. John and Mary McDougall. I'm their daughter and your host, Heather McDougall. Thank you for being with us tonight. Tonight, just like every night, Sundays at 5 p.m., we're going to get to general questions. I have dozens here in front of me, and I know many more are going to come in, and I will do my best to answer as many as I can. Hi, Mom and Dad, Dr. McDougall and Mary. How are you? Nice to see you.
We're good.
We've been working hard this week, getting ready for you guys. Yeah, and let's see. I don't know.
What do you want to talk to them about today?
What you know I've got something to talk to them about that I've been busy doing this week. You know that I have been. You know, I've been working on this talk about Ozempic and the semaglutide, make yourself sick injections for diabetes that so many people are wanting to take to lose weight because they can't. They can't because, you know, I think, and where I have to start off this whole presentation, which Heather, we've got to put this together. You know, you've got to put me on the line, give me a date, put some pressure on me so I can finish this talk up. But where we're going to start out is we're going to start out with the hunger drive, which I don't think very many people understand.
And Heather, if you put it off too long, he'll find a way to make it even longer because he keeps doing more and more research and he finds new things all the time.
Yeah, well, I'm going to get it
like
done.
This one he has to talk about tonight.
Well, I've got to make this new and important for people, and you know, I don't think that they're going to really get it unless they start coming to grips with themselves and the fact that they got this extremely powerful drive that keeps them alive. They got three of them that keep them alive. They got the drive for oxygen, not air, folks, but oxygen. Not just a drive for liquid to satisfy the thirst. It's only water that does that. And they've got this hunger drive, which is satisfied by carbohydrate, by sugar, by potatoes and rice and corn. And people just don't realize that. And they're trying to get satisfied by eating protein or eating lots of food. You know, I would like our listeners, you know, we get 6,000, 7,000, 8,000 people listen to this little hour presentation. I want you to take some time this week and find out about your hunger drive. I'd like you to stop eating. This is an extremely important part of your education, so you can realize why dieting doesn't work. It's just too painful, and why dieters and medical doctors and et cetera go to such extremes to deal with this powerful drive, the hunger drive. I mean, they put you on a completely bizarre, make yourself sick diet, which are the keto diets. You go into ketosis, you lose your appetite. Now we're given shots of diabetic medications, which result in an average weight loss of like 34 pounds. Takes you 68 weeks to lose it, and then you hit a plateau. Yeah. 68 weeks. How long is that, Mary? 52 weeks is a year, so more than a year. Okay, so you lose pretty well for a while, and then your body adapts to being sick, and then you don't lose any more weight. It's a 38-pound weight loss on average that you get by taking these shots, which could be twice a day, could be once a week, cost over $1,000 a week. A month, $1,000 a month. And if you add up 68 weeks, I think that comes out to $17,000 for 38 pounds of weight loss. And then you hit a plateau because you finally get to the point where, you know, your body says, hey, you got to eat, even though you're sick, by being shot up with Gila monster venom. Look it up. It's Gila monster venom. Anyway, Mary, I just wanted to, we got to take it and make it real clear understanding, because most of these people haven't done it. They haven't been hungry.
Well, how long do you want them to be hungry for?
Just a weekend.
A weekend.
Do you remember when we did that?
I do.
Come on, tell us a little bit about it. From your point of view, what was that experience that we went
this
without?
was like 30 years ago.
Well, Heather was a little baby, yeah.
No, she
young
was,
girl.
Yeah, she was probably 6
So
or so.
40 years ago.
Yeah.
40 years ago. Do you remember that, Heather, when we did that?
I do, very, very clearly. You wouldn't let us participate at all because we were too little, but I remember.
Yeah. And so we belonged to this small church in Honolulu. And at the time, 40 years ago, they were having all this hunger in Africa. And people were actually talking about the starving people in Africa and things like this. So we decided that as a church, oh no, you challenged
I was
them.
the instigator.
Yeah,
You know
were
me.
always the instigator. What? Well, then you have to tell them your story.
Well, yeah, it was this starving. I said, this is a wimpy way to show sympathy for starving people in Africa. Good grief. You're supposed to be holier than thou, you in this church. So I probably didn't tell him that. So I said, let's show some real empathy for these starving people all around the world. But this was a focus on African people and African children, of course. And so I said, look, why don't we go without food for the weekend? And I got half the congregation to go along with me. No food at all. And I'll just tell you from my point of view, I'd like to hear how you felt about it, Mary. Maybe you should start.
Well, it was difficult, but it was only difficult the first day. After that, it's sort of like my body got used to it. But I can still remember, and Heather will probably remember this too. We actually went on a picnic to the beach on either Saturday. I think it was Saturday.
Saturday, because
Saturday,
like Sunday
and I was making sandwiches for the kids, and I was making peanut butter and jelly sandwiches to take to the beach for the kids. And I was going to like lick the peanut butter and jelly off the knife because I was so hungry, and then I made myself stop because I didn't want to break the fast. So I was then hungry.
Yeah. Well, it's a great experience, and you don't have to wait long just a few hours to realize what you're dealing with, this hunger drive. It's so powerful. I really am serious. I think you should do this as a challenge. Set aside a weekend or 3 or 4 days.
But you have to be healthy to do this. Just anybody can't do this, right?
Well, if you're on medication, I certainly wouldn't do it.
Yeah.
And if you're, seriously, thank you, Mary.
Okay.
But otherwise, if there's no contraindication to it, just find out what you're dealing with as far as a hunger drive goes. My experience was Friday night, I thought, no big deal. This is just a matter of a few hours. And then Saturday morning, I started thinking about food. And by Saturday evening, I had no more problems. I had no more money problems. I had no more marital problems. I had no more problems with my kids. I only had one thought on my mind, and that was food. And I guarantee you within 24 to 48 hours, you're going to know how powerful this drive is. It's there to keep you alive. That's all you think about. And then I remember Sunday, you had a lot to do with the meal that we had.
Well, yes, we decided that to break our fast, we would gather together in the church, and I brought the food, and we made the food a typical African style meal. So we had a lentil stew and just a simple plain lettuce salad with nothing fancy in it, and some flatbread, just like a typical meal that you get in Africa. And I don't remember what, I think we had rice too. Or millet.
Well, I can tell you for the half of us who participated to this point, it was the best meal we ever had.
Yeah.
And it really is a powerful lesson. And then once you understand this drive, if you don't want to take a weekend, you can go without water for probably a day, and that'll be enough. And you can find out about the thirst drive, and you can go without air for say 2 or 3 minutes, and that'll teach you about the breathing drive. But to really appreciate the hunger drive, you need to get out to a point of about 48, 72 hours at most. Then you realize how difficult this drive can be, how powerful, painful. And you try and fight it with a diet. And you wonder why you have to go to such extremes, like no carbohydrate at all, a keto diet, a make yourself sick diet, one that threatens your life with heart disease and breast cancer and colon cancer, all those animal foods and that oil. And then you go and you take shots and you spend $17,000 to lose 35 pounds. And it takes you a year and a half. And you got to go to the doctor all the time. And good grief. And
well, don't you think though? But I mean, well, I was thinking if people didn't eat for 2 days, I mean, anything would taste good.
Anything would taste good.
Eventually, you just want to eat whatever you could find.
And what you need to understand is after about 72 hours or more, you go into ketosis. You start burning body fat instead of the glycogen that you stored up, the sugar. You start burning body fat and you go into ketosis, and ketones suppress the hunger drive. So the pain of starvation is dramatically decreased after about 2 or 3 days. Now, we never went to that point. We quit after just a few hours. And
no,
so
2 days. Well, we started on Friday night.
Quit Sunday afternoon.
And we quit Sunday afternoon.
Well, this encouraged me, and I'm going to end in just a minute. This encouraged me to look at some of the work of one of my heroes, Ancel Keys, Keys, Ancel Keys. You'll want to look him up. He's the man that really is the foundation of the Mediterranean diet. He did the 7-country study where he showed the difference in disease, particularly heart disease, worldwide based upon diet. I mean, he started all this condemning meats, dairy products, and recommending that we eat a starch-based diet. Ancel Keys did. Anyway, he was alive during the time of World War II. He was in practice. Some of you may recognize K rations. He developed the K rations, which were very high fat, very high protein blocks of food that the soldiers had to eat when they were in battle. Did a couple of things, gave them some calories, but also because it had virtually no fiber in it, they hardly had any poop.
Oh.
So they didn't leave a lot of trails behind them for the enemy to sniff. Anyway, that was one of the reasons. So it was K rations, it's called, based on Ancel Keys. So he did the stuff on cholesterol. That's why you are recommended a low fat, low cholesterol, low animal food diet. Ancel Keys, Keys. And he developed K rations, probably did a bunch of other things, did a whole bunch of experiments. Well, anyway, he was alive during World War II. And at the end of the war in 1944, he actually started this experiment. There were all kinds of people starving all over Western Europe. I mean, people were, you've seen the pictures of people, refugees and people in prisoner of war camps, and the skin and bones that these folks were. And so he wanted to study under experimental settings what starvation was all about. And so he got 36 conscientious objectors, COs, conscientious objectors. These are men who didn't want to kill. So they resisted the draft, didn't want to go to Europe and kill people, but they were willing to serve their country. And so they volunteered for a whole bunch of community service programs. And one of the programs that 36 of them volunteered for was the Minnesota Starvation Program. Okay, and what they did is that they were at the hospital, it was a Minnesota hospital, and they lived for a year. And Ancel Keys controlled what they ate for a year. And what they did is they starved them. First, they fed them as much as they wanted for, a couple of months. And then they put them on a starvation period for about 12 weeks. And they caused them to lose 25% of their body weight. And then what they did is they refed some of these people. They refed 12 of them. But let me get down to the period of starvation. They were obsessed with food. I just told you about Mary's and my experience during the weekend, but they were like, that's.
Well, did he starve them, or did he allow them to have some food?
He cut their calorie intake in half.
Oh, okay. So
yeah, they had some food, yeah.
They were eating, but they were still hungry.
Still hungry.
Okay.
But enough so that they'd lose about 25% of their body weight. So they were hungry all the time. And, they described things that these men would do, like they would read cookbooks. They'd talk about food all the time. They would lick their plates. They were so hungry. And, they became quite depressed, and they cheated. Actually, sometimes they cheated. They were so, even though they had a whole bunch of patriotic thoughts about getting this experiment done, it was so hard for them. All right. Well, that just shows you how powerful that drive is. You have any doubt, you read about the Minnesota starvation experiment, okay? Ancel Keys, and you read what these men went through. In fact, there's some YouTube videos which shows you pictures and some, verbal descriptions of what they went through. And you'll understand what the hunger drive is all about. But the last phase of this experiment is particularly important for many of us. And that has to do with the refeeding. What they did is they refed these people, 12 of them, these men, as much as they wanted. When they were done with the starvation part, you can eat as much as you want. And what they had happened to them is they went into an overfeeding phase, where they gained a whole bunch of fat. And until they gained the muscle back that they'd lost, they didn't stop this overfeeding, which is one of the arguments that's used as to why diets don't work. You put yourself through this terrible deprivation, this terrible suffering, this pain that you remember, you never want to happen again. And your body is just set to recover. And it puts on an extra bunch of fat. What did 60% greater fat did I compared to controls? Anyway, it'll be on the research paper that I showed you. They put on a lot of fat, but not muscle. Okay, just fat. So here you are, you're dealing with the hunger drive. I know you've tried the pain of hunger, that didn't work. And then you refed yourself and you gained all the lost weight and then some, didn't you? Well, the same thing happens when you go off a keto diet. You can't stay sick forever. I know these people try. They're very enthused, these Atkins followers. So, you can make it for a while, but eventually, even Robert Atkins, in 2000, I was involved in the great nutrition debate in Washington, D.C. with Robert Atkins. And even he was overweight. In fact, I tried to embarrass him in front of 500 cameras, in front of a panel that included Dean Ornish and a bunch of other experts. I tried to embarrass Dr. Atkins because of his body weight. I said to Mary, when I was preparing for the lecture, I said, Mary, right here, Robert Atkins, who I hope will be sitting right next to me, and he was, you can look it up. 2000 nutrition debate, you can look it up. Anyway, he'll be sitting right next to me. I said, Mary, at some point, he's going to say that his diet works so efficiently, so easy to do, so wonderful. And I said, when he says that, Mary, I said, I'm going to say, stand up, chubby, and take off your coat and show us how well it works. And she wouldn't let me do it. It's one of the things I regret that I didn't do that.
See, he's always been this way.
Yeah, really. Anyway,
Thank goodness for you, Mom.
Robert Atkins died obese. I mean, we got his medical records. A doctor who was a friend of mine from Kansas City got his medical records from whatever the records department was on the East Coast. And we went on a book tour. We went on a news tour. We were on CNN News. I was on the front page of the New York Times. Neil Kavoda, I was on his show over it. Deborah Norville did her show. Anyway, a whole bunch of publicity after Robert Atkins died, obese, of heart disease. Now, I know I'd have to unpack a lot to tell you all about these things, but hey, folks, he couldn't stand his own diet. Why? Because the hunger drive is so powerful. But anyway, you only got one answer. And as sooner you get to it, the sooner life will be under your control. And you can get on with things that are important, like your family, your hobbies, your sports, your job. You stop thinking about food all the time or your personal appearance. You can't fix this in one swoop. And that is to eat a starch-based diet. And I've told you many times, and you've seen it. If you look around the world throughout history, there are no overweight people living on starch-based diets. There were 2 billion Asians before 1980 whose diet was 90% rice. It was white rice. There was no obesity, no type 2 diabetes before 1980. No, somewhere around 12% of the Chinese population what did I say? About 12% has type 2 diabetes, frank diabetes, and half are pre-diabetic. And obesity is rampant. Why? Because they gave up the starch. So, my encouragement to all of you and to all the people that you love is to tell them they can't win except by doing the right thing, which is to eat the diet of a human being, which is the diet that 99.99% of people who ever walk this earth have consumed. Yes, they have. And as soon as you get back to the natural diet of people, which is oatmeal for breakfast, hash brown potatoes, waffles and pancakes, lots of good things. We're having pea soup tonight, pea soup and bread. Once you get back to the diet intended for you, you don't ever have to worry about a diet again. You don't have to worry about your bowel movements either. You don't have to worry about your blood pressure or your cholesterol. Probably not. I mean, some of you have abused yourselves to the point where you have unrecoverable illness, but not many. I mean, that's what our practice is about, is we take people who desire to be well. They don't feel like they deserve to be sick and overweight. They think it's unfair. They're such successful people. They say to themselves, I'm such a big success. I got an education, a job. I got a wonderful family. How come I'm so fat? And we are there to tell them why you're so fat.
Okay.
And how to solve. Okay, I'll get on with questions. That's enough. But that's what I've been doing all week. I kind of like to start out and tell you what I've been thinking about all week. Ansel Keys, the Minnesota Starvation Experiment. Look it up. Spend some of your reading time. Understand, you ain't going to beat the hunger drive. You might as well give in, just like every other animal does. Elephants do, giraffes do, hippopotamus.
All right.
All right, well, we've got some dates to get on the calendar, so we'll get those. We'll get those.
Yeah, you got to put me on the calendar so I finish this project. As Mary says, Mom says, I just won't stop. I just keep trying to figure out new things. But anyway, I'm ready to go. I'm ready to give the lecture.
Good. Okay. We'll talk about that this week. Okay. First question of the night. This is from Vay. She's wondering what your opinion is on candida issues in the gut.
Well, this has been a topic for a long time. Candida is a fungal infection, and it grows under certain circumstances. Like, for example, if you eat the Western diet. If you eat the Western diet, you have an elevated blood sugar, all right, and you have a compromised immune system. So the fungi, they just can get away with murder. They could just live. And so women get vaginal infections with candida, and you get bowel infections likewise with candida because of the fact that you're on a diet that causes the blood sugar to go up, and you're pre-diabetic or diabetic, and these fungi, they love sugar. Anyway, so how do you take care of it? Well, you know what I'm going to say. You start eating a good diet. Yeah, you get various kinds of fungal treatments. You can treat it from the top by taking probiotics and prebiotics. Probiotics are bacteria that you buy, bacteria and fungus and a bunch of other stuff, usually the bacteria. And you buy these in the store, in the health food store, in the drugstore, et cetera. And they're called probiotics, and they're acidophilus and lactobacilli and a whole bunch of other bacteria. I mean, there are actually companies that are out there to try and make the right kind of bacteria for you to eat. Anyway, you buy these bacteria. And then if you want, you can buy food that the bacteria likes to eat, which happens to be sugar. Of course, you can eat it.
But that's what we recommend that people eat sugar in the form of carbohydrates. Yeah. But
it doesn't make the blood sugar go up in their body.
Well, what about the candida? Doesn't it feed that?
No, because the candida lives in the body and the whole system. So it likes to eat at, say, blood sugar levels of 120.
Oh, okay.
But if you eat an unhealthy diet, you run blood sugar, you'll become diabetic. Half the people on the Western diet are pre-diabetic.
So it has nothing to do with the sugar that you eat. It's the sugar that's in your blood from the high fat.
It lives on your blood sugar. All right. So you can treat it from the top, but it's not going to work out. So just forget it. You're wasting your money. Acidophilus, I think this is the one that doesn't live in the intestinal tract. You have to keep giving it, or maybe that's lactobacillus.
That's lactobacillus.
Yeah. Okay. Or acidophilus just doesn't live well. Whatever. It doesn't make any difference. They don't like to live in the gut unless you keep repopulating them, keep buying the supplements. All right. And of course, what they like to eat. They like to eat sugar. So you feed them potatoes and rice and corn, and they're just as happy as can be. The other thing you can do is you can treat them from the outside. And you'll get creams, antifungal creams like Monostat vaginal cream, Lotrimin, Nicotine. These are skin creams. You buy them over the counter and you use them. But again, you're not going to do well unless you fix the problem, which is the fact that these candida, they love to live in a high sugar environment, which is what you create when you eat the Western diet. There's a whole lecture on diabetes that you can find on YouTube, which I explain to you how it works, how the Western diet causes your blood sugar to go up. Anyway, people on a healthy diet run blood sugars certainly below 100 milligrams per deciliter. 126 is considered diabetic. Between 100 and 126 is pre-diabetic. Healthy people around the world may run blood sugars of 60, 70. Not unusual for my patients to run blood sugars of 60, 70, 80. Fasting. Anyway, that's how you take care of it. So do that. I'm sorry I sound like a broken record. I really am, but is what you got to do. I'll try and bring some new insights like Ansel Keys and Minnesota starvation experiments into our discussion. It's the food.
Well, I think it's great that it's so simple and that it really all comes back to the food, and there's not all these different foods that we have to be eating. It's just a starch-based diet.
Yeah, you eat one kind of food for heart disease and another for your left breast and another for your right breast. You know, I mean, maybe we could sell products like that. We've got something real special for your toe fungus. You need to eat bananas and rice. Good for toe fungus.
Okay.
Anyway, yeah, you know, what you want to do is you just got this amazing body, which is being paralyzed and poisoned by the animal foods and the oils. You know, a diet that's just been around for 150 years to any popularity. I mean, it was once a diet for kings and queens and pharaohs and aristocrats. But now, because of the wealth, because of transportation, because of communication, you know, half the population on this planet, that's 4 billion people, eat the Western diet. The diet for kings and queens, yeah, it's normal. Unless you consider sick normal. Where are we going?
I don't know.
I don't know either. Anyway, that's the story on Candida.
Okay, great. Next
Yeah,
question.
Heather, I was going to ask you before we go on. You know, you sent me a picture yesterday. I don't remember the man's name, but oh my goodness, we're going to make him a Star McDougall, I hope. You
Isn't
know,
that great? He's half his size. He lost a whole half of himself.
yeah. But you know, the interesting thing is, I don't remember ever talking to this man. You know, I don't. He just kind of figured it out. Did he ever come to one of our programs?
No, just found our website.
It shows that you can do it right off the
This
website.
is stupid simple. It doesn't cost you anything. Of course, we're there to help you, and we help lots and lots of people. So, you know, take advantage of our knowledge, our efforts, our enthusiasm, our wonderful personalities. Anyway, yeah, I hope you get him up as a Star McDougall. That was just, I mean, really, you know, it's those kind of pictures that make my day. I think, you know, I like being a doctor when I see that the messages I have result in these kind of changes, and they always do. This is not the best case example, ladies and gentlemen. It's not like Ginny Craig or Nutrisystems that have this disclaimer that says this is the best case scenario. Don't expect these results. Ladies and gentlemen, expect these results. If you stop eating the animals and the oil, and instead you make your diet 90% starch with fruits and vegetables, you will get your health back, except for what's not recoverable. There is some damage you've done that's beyond the point of return, but you know that.
Okay, thank you. Next question. This is from Megan. She has an iron deficiency. According to her doctor, this diet was why. She was eating lentils, green vegetables, etc., but still deficient. Do you know how I can avoid this deficiency?
Yeah, the first thing every doctor needs to do, this is standard medicine. In fact, her doctor should be criticized. You know, he should be taken to task if he doesn't start this way. Whenever you deal with somebody with anemia, you must look for a source of blood loss. I mean, that's the first thing to think about. That's the most serious thing. You could be bleeding from an ulcer, from a hemorrhoid, from a diverticulosis, from a colon cancer, or you could be bleeding from your uterus. You know, you could have endometrial cancer, you could have fibroids, you could, you know, just abnormal uterus produced by an unhealthy diet. So your doctor is doing you a disservice by not going about something that's standardly taught to medical students, and all doctors should practice this way. You first have to look for a source of bleeding, and that's primarily the hidden sources are the vagina and the bowel. You know, otherwise you're going to notice where the bleedings come from. All right, so say you're not bleeding. How do you test? Well, you stool for blood, you check, you get cheap tests you get buy at the drugstore, and you know, obviously you can see vaginal bleeding. Okay, so you find out you're not bleeding. Then you ask the next question. Well, if I'm not bleeding, well, maybe I was bleeding 4 months ago, and I'm just trying to catch up. That's a possibility. Maybe you depleted your iron stores to the point where you're having trouble rebuilding those blood cells. And, you know, that happens. You become iron deficient. Anyway, you do some basic tests. You do iron binding capacity. You do a serum iron. You do a ferritin level. You do a reticulocyte count. You do a hemoglobin. They're all standard tests that doctors do. It probably costs you $20. And then you kind of get some idea as to whether this is a disease of bleeding and what your iron stores are at and what you ought to do. Well, the first thing you ought to do is give up the dairy, because the dairy is the number one cause of iron deficiency anemia in children and adults too. What happens is the dairy, we're talking about cheese, yogurt, ice cream, milk. The dairy, is high in calcium. They tell you that. That's how they advertise it. It's high in phosphorus also, and calcium and phosphorus, they bind iron in the gut and form insoluble complexes. So you're depleted of iron if you eat dairy in your diet. You can't correct the problem until you stop the dairy. The other thing that happens is the dairy protein causes microscopic bleeding of the gut. All right, so then you do that. You stop the dairy, and that'll fix it. If you haven't found a source of bleeding and you've stopped the dairy and you eat a healthy diet, by the way, which is a diet of lentils and beans, and they're loaded with iron, just loaded with iron. And when you eat, they have a kind of iron that is less well absorbed than meat iron. But when you eat ascorbic acid, the vitamin C, it enhances the iron absorption to at least as great, if not greater, than you get from meat just by eating the rest of the vegetable diet. So you get plenty of iron. There's never been a problem with enough iron in the diet, unless it's a diet made up in some laboratory. No natural diet is deficient in iron. Okay, so anyway, if that's not enough, you take iron pills, and ferrous sulfate is the one I remember prescribing. And you take those, and your stool turns black. You become constipated. You don't like taking pills all the time. I know that, but that may hurry up a little bit, not a lot, your recovery from iron deficiency. And that's the way you ought to be treated. And if your doctor's not treating you that way, you're welcome to take a copy of this tape and show them what I had to say.
Great. That was very complete. And I have so many people write me that very question. So I'm going to bookmark this video.
Yeah.
Thank you.
Yeah. And I encourage you to do this. Not only have I put this on various lectures I've given, and we do this at 5:00 on Sunday nights, but I've written 13 national best-selling books that deal with this, over 200 newsletters. So I've touched on all these topics. All you got to do is say to your doctor, look, I know you're interested in me and me getting better. I heard this doctor, tell me why he's wrong. Just tell me why he's wrong. Tell me why you're right and he's wrong. After all, you're making recommendations to me that are really costly and important. So you are the recommender. It's your obligation to tell me why you're right. Not Dr. McDougall's obligation to tell me why you're wrong, even though I do. Anyway.
Thank you. Okay, next question. This is from Anne, and she's wondering which foods help with non-alcoholic fatty liver disease.
Well, non-alcoholic fatty liver disease or fatty infiltration of the liver is something I've been dealing with my whole career in terms of my patients. And guess how you get it? You infiltrate the liver with fat. Fatty infiltration of the liver. That's how you get it. Now, where do you think you get the fat from? Oh, the food you eat. Okay. So you get fatty infiltration of the liver. The fat causes the liver to become inflamed. Your liver function tests, like your GGT or SGPT or SGOT, they will go up, showing you have inflammation of the liver. Not a big deal. Corrects easily when you lose the weight. But they tell me that if you keep the liver inflamed long enough, you could develop cirrhosis. I've never seen it, but I think it's something that ought to worry you. Fatty infiltration of the liver occurs only, as far as I can think of, only as a consequence of the Western diet. Or let's just say the vast majority of cases. And how do you solve it? The same way you solve fatty infiltration under your skin. Fatty infiltration of your buttocks, of your thigh, of your abdomen. Fatty, I should stop there.
Yeah.
Anyway, so you just stop eating the fat. The fat goes out of the liver, the inflammation stops, and hopefully you haven't gotten to a point where you cause permanent damage, which they say you can. The science is absolutely clear that what I told you is true. But it makes sense, doesn't it? I mean, good grief. Fatty infiltration of the liver. Let's see, where do I get that? Probably eating sugar. Yeah, sugar causes it. Well, maybe it's eating fat. Sugar doesn't help, folks, but certainly white sugar doesn't. But potatoes and rice and corn and so on are just lovely for fatty infiltration of the liver.
Okay, great. Thank you. This next question is from Rick. Can a starch-based diet help with cardiomyopathy and an injection fraction of 35%? I have a pacemaker and a mechanical mitral valve, and I'm taking Entresto.
Yeah, they advertise it on TV all the time, Entresto, which helps with heart failure. And I think it probably does. I mean, after all, they've done the research to say it helps. And it may be something you want to take advantage of. I haven't read about Entresto for quite a while, but I see it advertised on TV just like you do. It must be an extremely expensive drug for it to occupy so much space on cable news. Anyway, what you do.
But does it work?
Yeah, I think so. I think it probably works, Mary. I'd have to look up the studies and see what they did. But it costs, and there are side effects.
Yeah.
And it's not you're buying a drug to help with some of the signs and symptoms. It's certainly Entresto deficiency is not the cause of your heart problems.
Okay, well then tell them what it is.
Okay.
Wanted to know.
Cardiomyopathy is due to infiltration of the tiny blood vessels that supply the heart muscle. When you infiltrate and damage the large blood vessels, you have coronary artery disease. In other words, the doctor can go in with a tube, catheter, and can blow dye into your arteries and say, you got a blockage here. That's in your big arteries. Okay. But those kind of tests don't show blockages in the tiny arteries. So it's the tiny arteries that get damaged, infiltrated, that result in most cardiomyopathy. There are also some poisons like cobalt, for example. I know you really want to know that. There's a beer drinking problem, which was associated with some cobalt in the beers that were being served, and they cause cardiomyopathy. That's not your problem. Your problem is eating the rich Western diet, which closes down not only the big arteries, but the little arteries. Okay, so the first thing that you end up accomplishing, a whole bunch of things. One is you improve the circulation, which I've shown you. I've shown you many times the sludging of the blood that occurs when you eat fat, animal fat versus vegetable fat. The blood cells get coated. You drop the oxygen content by about 20%. Can you imagine 20% more oxygen to your heart? How happy your heart would be. Heck with Entresto. I bet Entresto can't do that. Anyway, there's a 20% reduction in oxygen content. We call it oxygen tension by eating a single high-fat meal. So you stop the sludging, you improve the oxygen content of the blood. The other thing you do is when you change your diet, you'll be eating a low-sodium diet, which takes a tremendous load off the heart muscle by decreasing the volume in the system. That's a good thing to do. Those are the main things that happen. A little careful exercise, so it could build up the heart muscle a bit. So cardiomyopathy came as a consequence of years of eating the rich Western diet.
What is the definition of cardiomyopathy?
Well, what it is it's a weakness of the heart muscle, and it's usually an enlargement of the heart muscle. So instead of the heart muscle being an efficient muscle, it gets filled with scar tissue.
Okay, so it can't pump.
No,
His
ejection fraction was 35%.
Right, okay.
So it's weakened because it's infiltrating with scar. Why is it infiltrating with scar? Because the little blood vessels, the little arterioles, they got plugged up, and you had little tiny heart attacks.
So many people don't know what an ejection fraction is.
All right, an ejection fraction is how much blood the heart squeezes out with each contraction. Ejection fraction. Okay, so a normal ejection fraction, normally when the heart squeezes with every systole, The heart injects 65% of the blood. That's considered normal. When you get down to 50%, doctors get a little concerned. Actually, if your ejection fraction is below 50% and above 35%, there's some research that says that bypass surgery will be of advantage to you. Okay, so you might want to look into that. I don't recommend heart surgery, except in really unusual. I can't. Anyway, yeah. So you've got a 35% ejection fraction. I've known patients who have an ejection fraction of 10%, 17%. You got plenty of heart function. You're not going to run a triathlon or a marathon, but you can certainly go out and do the shopping with that kind of heart function.
And you can reverse it also by eating a healthy diet, right?
Not the scar tissue.
So you can never fix your ejection fraction?
Oh, good. Yeah, you probably can. Yeah, you improve it. You improve it.
Okay.
What we've seen is I've seen improvements in ejection fraction over the years, many times. I'd have to look up whether anybody studied it to see the research. Yeah, it does. It does improve the ejection fraction with a change in diet and weight loss, and mostly a change in diet. Anyway, there are other drugs that are used when people have cardiomyopathies, like ACE inhibitors and beta blockers. And, once one set of drugs comes out of favor, why did it come out of favor? Well, it's now generic. So we got to find some other remedy for your problems that is brand name, instead of being able to charge you like $10 for 90 pills at Walmart. We charge you $9,000 for one pill at Walmart. It's called innovation. It's called marketing. It's called business. And that's why you see drugs go out of favor often, is you've got to, in addition to bringing a new drug to market, you've got to badmouth the old drugs. That's why diet gets so little attention. Believe me, if they gave diet half as much of attention as they give to the drugs that you're being prescribed, wow, it would be a whole different game. The drug companies would be in huge trouble. Your doctor would feel good about what he or she does. Because right now, ladies and gentlemen, if your doctor is treating chronic disease, your doctor is miserable, because you don't get better. You get managed. You get changed from one kind of pill to another. Yeah, that's all they do. They manage your diabetes, your high blood pressure, your heart disease. They never talk about cure. We talk about cure. One of the most fun things is graduation every time when Dr. Lim, our medical director, talks about the people who've been through the program. And he almost always, for the last couple of years, he started out by saying, I was trained to manage patients. And they talk about it in the ads. If you watch the ads on diabetes, they talk about managing patients, never getting them better or curing them. They just manage them. And he says, I don't have to say that anymore. The patients who go through this program are cured. He has used the word reversed. I think I've convinced him not to say that. The word's cure. When you stop the cause of a problem, you cure it. For example, if you have a bad cough and you wheeze and you stop the cigarette smoking, you have cured your lung problem. Now you could switch between Marlboros and Chesterfields. That's called managing. Those are cigarette brands. Lucky Strikes.
Yeah, they probably don't make those anymore.
You probably don't. Mary and I remember those. So believe me, we remember them too well. You're getting cheated. Well, maybe your friends and relatives want that, but I know you don't. You can have everything that we told you. You will reverse, you will cure more diseases than you can imagine. There will be some things left over that are permanent, but not many. You'll be amazed at what your body can do to heal. You have it 12 days. I wrote a book called The McDougall Program, 12 Days to Dynamic Health. It was a New York Times national bestseller. We run a 12-day internet-based program, 12 days. We'll take you from beginning to end. We'll adjust your medications, reduce those that need to be stopped and reduced. You'll get all the education that you want in 12 days, and then we'll take and follow up with you for a whole year to make sure you're being on track. That's what we do. We're not into it for the one-night stand. We're into it for cure. Yeah, I'll use the word cure to any of my colleagues. And let's see you deny it. It's called cure, not reversal. We'll go into that a little bit later as to why that's not the right term. It's not manage. It's stopping the cigarettes, stops the cough and the wheezing. Stopping the booze, stops the damage to the liver. You're cured. Stopping the bad food, stops the artery disease, the arthritis, the et cetera, the constipation, et cetera. You fix the problem. Is this too hard to believe? What is holding you back? I know you're waiting for the new drive to get control of your hunger. Yeah, well, replay this tape and I'll show you it ain't going to ever happen. Ansel Keys, the Minnesota starvation experiment. Spend a little time this week reading about it. You won't beat that hunger drive. You got to satisfy it, which you do with a starch-based diet. You'll see. Research shows that. Research, when you compare different satisfactions that people get based upon what you feed them. You'll do this in metabolic ward experiments. People report satisfaction when they eat carbohydrate, sugar, not fat. That's right. You can feed your subjects fat. They don't even notice. Protein, they notice some satisfaction, but not fat. You can eat fat until you weigh 1,200 pounds and you won't even notice it. Just one more pork chop. That's all I need is one more. Anyway. Yes.
Okay, thank you. Next question. This is from Karen, and she wants to know how you feel about the eating right for your blood type diet.
Oh, is that still around?
Oh, yes.
Dr. Diamino, I think it's Diamino is his name. He's a chiropractor. And it's been a popular diet because, again, this is an approach where you can say, it's not my fault. It's not my fault I'm obese and sick. I got the wrong blood type. I'm not eating for the right blood type. Just like you say to yourself, is my stomach is too big for my body, or I'm mentally ill, or I've got the wrong genes, or it's because I won't exercise. It's my fault. So Diamino really plays into with the blood type diet of making you think, oh, we finally figured it out. We got a new gimmick. Well, the way the thinking goes, if I remember the book, I haven't read it probably in 20 years. The way the thinking goes is that Asian people are primarily blood type A. Europeans are primarily blood type O. If you think about it, when you consider what Asians eat, what comes to mind is rice. All right. So if you have a type A blood, you should be living on a high rice, high carbohydrate diet. Type O diets are associated with whites primarily in Europe. All right. And they have type O. And of course, whites, wealthy whites in European countries, Canada, United States, what do they live on? Meat and dairy.
Well, people live on potatoes.
I don't know many Americans who live on potatoes.
Well, I don't either, but
if you went to Peru, you'd probably find that same story. All right, well, let me get to the bottom line because I know you want to move on with questions. But this is very appealing to people. And you know me, I just want you to like me so bad. I've decided the next book I write is called The Shoe Size Diet. That's right, folks. If you have small feet and wear small shoes, you need to eat rice. If you have big feet, like Europeans and Caucasians have, then you should eat meat and dairy. It's the shoe size diet. Oh, I don't know. We could go on, blue eyes and whatever you want. It's silly. And the consumer, because they're so desperate, falls for it. Look, just believe that your creator, whatever your theology is, just believe that you were designed correctly. And you're just not following the right set of rules. And Mary and I and Heather have shown you the right set of rules. Now it's up to you. You want to take advantage of this, or you want to continue to buy into the blood type diet or some other new nonsense that's out there? How about the shoe size diet? Save your money. We got kids going to college. Save your money. Invest in our shoe size diet.
Great. All right. Everyone listening in on this call is loving the shoe size diet. Lots of great comments in the chat. Okay, next question. This is from J18. I recently had a complete metabolic panel. Everything is great. The only thing that wasn't normal was a high calcium score of 10.9.
Right.
Do I need to be concerned? I'm 71, thin, follow your diet and exercise 4 to 5 times a week.
Well, likely all I would do is have you follow it along if you were my patient.
What does
Elevated,
that mean?
follow along, repeat calcium test.
Oh, okay.
This is a sign of hyperparathyroidism, which is where the parathyroid gland produces extra parathyroid hormone. You can do another test, which is a parathyroid hormone, which you just check a blood test and you see if this is the case. So your parathyroid hormone will cause your calcium to go up. Is this a problem? Well, first of all, how did it occur? It occurred by overstressing the parathyroid glands, which are 4 glands. Okay, they're parathyroid. Here's your thyroid right here. You got 4 glands, 2 on top, 2 on the bottom. And these glands, they regulate calcium and phosphorus metabolism, bone health, kidney, etc. Okay, so what happens is when you eat a diet that's high in phosphorus, meat, okay, low in calcium, meat has virtually no calcium in it. Then what happens is you cause those parathyroids to start working overtime to correct all this phosphorus and lack of calcium that's coming in. So it starts producing more parathyroid hormone to correct the imbalance, and eventually it becomes autonomous. Just works without, even doesn't even care what you eat anymore. It just is doing that. So in most cases, the way I've taken care of people who have this condition is I just check their calcium and their parathyroid levels once in a while. The standard treatment is to have the surgeon go in and cut a couple of parathyroids out. That's what they do. So they're going to take a cut. And the problem is they may cut out too many. And then you become hypoparathyroid. And then you've got big doo-doo you're in. So be careful what you ask for. But that's the way it's generally treated, is to cut a couple of parathyroids off. But again, let's take it back to the beginning. You have a slightly elevated calcium. If you were my patient, all I would do is check it maybe every year, see what's happening. You're going to be told that you have an increased risk of osteoporosis because of the elevated parathyroid hormone. Not much. Go for a walk, get a little sunshine, eat a low animal protein diet. You know how I've taught you about osteoporosis. I don't think you'll have any trouble. At least the patients I've taken care of haven't. But if you do, I bet I know a surgeon who'd be happy to take 2 of your parathyroids out. I bet I can find 100 of them in my town who'd be thrilled to have the business.
Okay, thank you. Next question. This is from Victoria. Can a starch-based diet reverse gastroparesis?
Yes. Yeah, gastroparesis is a condition where the the intestinal tract, is semi-paralyzed. And you end up with problems like constipation or malabsorption problems. And it's common with people who have diabetes. Why? Because there are nerves that go to the bowel, which are damaged. I've heard of peripheral neuropathy when you have diabetes. So the blood vessels and the nerves to the gut are damaged. And as a result, you have gastroparesis. Not a lot of options out to treat you except to eat a healthy diet. And again, I've had this experience, and I can only tell you, I bet there's some literature that shows it too, that eating a high fiber diet, a low fat diet would be advantageous to people with gastroparesis. I bet it's in there. I haven't looked at it in a while, but you can look up. You know how to do that. So, that website I told you a couple of weeks ago, I'll tell you again, what you go is to www.sci, okay, Sierra, Charlie, Indigo, hub, HUB, Hotel, Uniform, Bravo. Get them right?
No, you missed India.
What did I say, Indigo?
Indigo.
I haven't been flying a long time. All right, so you go there and they move this site around to different countries. Right now it's in Russia. So it's .ru. So you go sci-hub-ru. That's the website. And you have access to pretty much every article published. I was challenged by the fact that the colonoscopy article that I've been talking about for the last couple of weeks is not available. And I was surprised because Sci-Hub almost always gives every article free.
That's not there?
No, I couldn't download that one, Mary. And the only way I could get it was through my university association because I'm an
You
assistant.
don't want anybody to know it yet.
I don't know why it's not up. It should be, but because other articles published in the New England Journal of Medicine, recent ones are up there. I don't know why it's not. Maybe they don't want to. Maybe they don't want anybody to know that colonoscopy is a complete failure.
Sounds reasonable.
Pretty darn close to a complete failure. Look it up. Published in October of 2022.
They can't look it up. You just said they can't
No,
get
but
it.
they can get the PubMed article.
Oh, okay.
That you can't get the full article. You can get the abstract, and you can see that there's no survival advantage. The data I showed you. But anyway, how do we get on that?
I don't know.
We were
don't have a
talking about
phone.
gastroparesis.
Oh yeah. My experience has been that people who have gastroparesis, in other words, the bowels are terrible. They're sluggish. They're constipated, and sometimes they have other intestinal problems. They eat a starch-based diet. Goes away. You should expect that. How long does it take? Probably about 72 hours. You'll get better in about 72 hours. Most of the time, most of the things I tell you about, you get better within 4 to 7 days. All right? If you can't do something for 4 to 7 days, I mean, good grief, these conscientious objectors.
Conscientious objector.
Thank you, Mary. The 36 of these men who didn't want to face the battlefront, they did this experiment for a year. You could do something for 4 days, 7 days. I bet you can.
Even 12 days.
Even 12 days. Oh, that's right. We run a 12-day program. We can't let them go home early because they really need the extra help. Anyway, it doesn't take long. The body responds. All right. So you told me I'm pretty much out of time. What else we got going on here?
You've got 2 minutes. Okay, this is, I think, will be a good one to wrap it up with. This is from John. He's been following the diet, doing really great. However, he's got some persistent high blood pressure. What would you tell someone that feels like they're doing everything right, but that blood pressure just won't go down?
Well, I would say go to our 12-day program because we see over and over again, and this is not a publicity push to get you to do it. It's just that we see over and over again people whose cholesterol won't come down, their blood sugar won't come down, and they can't stop the medications, and they go through the 12 days with us. And Tiffany or Stacy, they spend every day with them and make sure they do the diet right, and they get the education that they're looking for. And lo and behold, they drop their cholesterol 30 points. And lo and behold, their blood pressure is normal. But if it's not, we're board certified doctors. I'm a board certified internist. That's a big deal. Dr. Lim's a board certified family practitioner. That's a big deal. He's also an attorney. But hey, we prescribe medications. I have a prescription pad. We will put you on the most effective, safest medication available, which is chlorothalidone. And by the way, you may want to go to YouTube if you have that problem, and you may want to look up the lecture that I gave, hour-long lecture on hypertension. Just look up McDougall and hypertension. It's right there. It's free. Got to watch a few ads. But anyway, some people will need to be on chlorothalidone. Not very often, maybe 1 or 2 or 3 in 100 that we take care of. Well, I can tell you, we get 90% of people that reduce or stop their medications. That's what we publish that.
And sometimes people that come to us and they say they're doing the diet perfectly, they come to us and they find out, well, there's just one thing that they're not doing exactly right. And when they learn what they're supposed to be doing, everything works out fine.
You mean I can't have the dairy-free chocolate ice cream with fudge in it at night after I finish dinner?
No, you can't.
Oh my goodness, she's tough.
Okay, we've run out of time. That
All
was
right.
an hour and it went by fast.
Well, I want you to spend just a minute. We're going to do, I think we should do the lecture free, but you decide, whether you want to charge for it or not. But I think we should we should invite people who are our followers, the people who are on our Instagram, who are on our mailing list, to attend the program for free. We're only going to let 100 people in. So you need to pay attention and
You're
sign
gonna
up.
have to do it 3 times then.
No, I'm only going to do it once. But we'll put it up on YouTube afterwards. It's just so you have a chance to ask questions. You get a chance to see it live. We're going to do that. So we'll do that sometime before.
Well, by next Sunday, maybe you'll have a date picked out and you can announce it.
I'm ready. Heather, put some pressure on me. I
All
will.
right.
We will.
And then we're going to do
Yes.
the whole series, the whole medicine series. We've got 10 or 11 lectures. There are 2-hour lectures, total of 4 hours each, which we're going to do 2 weeks apart over a 10-week period or be 20-week period of time. We're going to start that. We're charging for that. So we're going to do that. And then, of course, we've got another 12-day program coming up. We just finished one. Get signed up now. There's a good chance it's going to be full. So if you're thinking about it, sign up. That's the hard part. Just like if you're going to write a book, people ask me all the time, I want to write a book. How do I do it? Put the first word on the paper. I want to get my health straightened out. Well, you pick up the phone, you dial 1-800-941-7111, or you tune into drmcdougall.com and you send us an email. Just get started. And of course, it's free on the website. But we're here to help. When are you going to run another program, Heather?
Our next course is March 3rd.
All right. So
Only a few weeks away.
yeah, we'll be there. Mary and I will be there, and Heather and the whole team. And we're just like always, we're going to put 100% of our effort into getting you to change. I would say pretty much everybody who's been through the program, comes to the conclusion this was the best money and time they've spent, and that the McDougall's and the rest of the team are very interested in them personally. That's the promise that I'll offer you. Okay, Ansel Keys, Minnesota Starvation Project experiment. Study it. You're not going to win. You're not going to beat your hunger drive. Give in. Starch-based diet. That's the whole
All right. Thanks, Mom and Dad, Dr. McDougall and Mary. That was fun.
Okay.
All right. Good.
See you
Goodbye.
all next Sunday.
Okay.
All right.